most of those who applied for the SPS were mga chichirya, hot dogs, no? So nagka-moratorium. So at that time, nagpo-push din yung industry for front of pack labeling. So eventually, they were able to have FDA issue a voluntary front of pack label using the barrel sign, but only so far for energy, no? So that was in 2015. And more recently, hindi na reni yung ano na, PDRI. So ilang years yun? 2015 yung PDRI, 2023. So 8 years bago na-adapt yung new standards for the basis for the labels. And the good news is, in the Philippine Development Plan, there's very specific focus now on ensuring food security and nutrition. Now, in this portion, it says, intensify promotion of food labeling and food safety measures. So if it's in the PDP, then it should become also a priority legislation, no? And along with the other targets for improving nutrition across all ages. And let me get to you now that the PPAN, or the Philippine Plan of Action for Nutrition, is aligned with the PDP and also includes, of course, FOPL. The PPAN is anchored on a theory of change where, to reduce all forms of malnutrition, Filipinos need to consume and demand for adequate, age-appropriate, nutrient-dense, diverse, affordable, safe, and sustainable food. So, before that, when we say healthy diet, we don't have an official definition that has been adopted. So, we use the WHO definition. A healthy diet emphasizes the whole foods, no? Vegetables, fruits, whole grains, root crops, fat-free or low-fat milk, lean meats, poultry, fish, eggs, beans, nuts. And it should be low in saturated fats, trans fat, cholesterol, sodium, and added sugar. So may exam mamaya. So in thus, the strategic framework of the PPAN emphasizes healthier diets coupled with better practices and improved access to quality services. And in the strategic framework to have healthy diets, we see nutrition labeling as an intervention to transform market choices towards nutritious diets. And as a result of nutrition labeling, we hope that it will also drive food reformulation towards increasing availability of healthier food options. And a companion plan of the PPAN is the Overweight and Obesity Strategic Plan that we developed starting last year, no? And we hope to have this presented to the NNC TECOM next week. So the strategic area of the plan on policy and regulation includes these priority interventions to improve the food environment. So these are also aligned with the DOH health promotion strategy. So the development of FOPL guidelines as well as advocacy for its legislation are among the priorities. And many of these interventions require a means to classify food in terms of nutrient content. So the NNC is leading the formulation of the Philippine Nutrient Profile Model. So initially intended to be for marketing regulation of unhealthy food and beverages to protect children, but consultations from stakeholders emphasized that the model should have multiple uses. The DOF, Department of Finance, requires an NPM for taxation of junk foods, FNRI for FOPL, the SWD for government food procurement for emergencies, and other agencies and LGUs for exclusions in dietary supplementation programs. No? But we see that the PNPM should be tested and validated for each specific use. But I will not discuss that. But instead, those who are interested, we have the public consultation scheduled on May 14 in the morning at Lanson Place, Mall of Asia Complex. So if you want to be invited, you may approach si Miss Rocky Cordero. Rocky, please stand up. So yung gustong mag-attend po, puntahan na lang po siya. Or bumulaga na lang kayo doon. Bahala na si WHO magbayad. Yan maganda pag may baka si Dr. Bella magbayad din. So, and the obesity strat plan also is justified with the Philippines having been identified as one of the front-runner countries by WHO for its acceleration plan to stop obesity. So, kailangan tayong talaga, gawin lahat ng mga ito kasi we've set very ambitious targets on reducing obesity. So, tinitingnan tayo ng mundo. So, wag tayong patalo, wag tayong pakulelat dun sa ibang countries. Kailangan magyabang tayo kasi Pilipino tayo. Mayabang mga Pilipino. So, the Philippines may choose from the WHO technical packages that are evidence-based and would have the most impact on obesity reduction. So, food labeling is one of those interventions. And through the request of NNC, WHO supported FNRI to research on FOPL, and that will be later presented by that handsome gentleman, Carl. So, wala akong ting-ting, pero may sign doon, nakita ko. So as you have heard, that's my last slide. As you have heard and seen, FOPL is very much aligned with the national directions under the PDP and the PPAN. There are already bills filed in Congress on FOPL. There's one that proposed yung star rating, yung House Bill 9819, yung warning signs naman na label. And keep in mind, the DepEd policy uses the traffic light na symbol for schools, and I would assume the teachers, the parents, and the students will be familiar with this. And the PNPM is for warning signs. So we need to really look at the evidence for us to be guided with our decisions, and we hope that this will be the start for us to come together and have a common direction on how we will do FOPL in our country. So we look forward to a fruitful discussion. Thank you very much, and good morning to everyone.
Thank you so much po, Ma'am Jovi. Thank you, Ma'am Jovi Raval of NNC. And now to help us, na-introduce na rin po kanina ni Ms. Jovi, no, to help us understand more about the FOPL that has been implemented in various countries around the world and how the Philippines may adopt its own FOPL scheme. We have nutrition specialist of the UNICEF Philippines, Dr. Maria Belia Fonferrada. Ma'am, I have questions pero mamaya na po.
Good morning, everyone. So I'm actually tasked to give you the core information related to front-of-pack nutrition labels. Although the technical people here will actually know this extensively now, your additional comments will be very much welcome later on during the panel discussion. So what we need to know about the front-of-pack nutrition label. Yeah. So this is the outline of my presentation. So I will provide you with an introduction to the front-of-pack nutrition label, the logic model for FOPL. I will also provide you with a global snapshot of the different FOPL systems and the spectrum of effectiveness, and a summary of FOPL evidence, what works best. This is as of 2022. The information we have here is as of 2022, and additional important considerations. Okay, so front of pack nutrition labels, these are actually nutrition labeling systems that are presented on the front, as the name indicates. On the front of food packages, with the aim of supporting consumers to make healthier food choices at the point of purchase. So this actually are simplified at a glance nutritional information, and these are intended to complement and interpret more detailed back-of-pack nutrition declarations. So this was already presented by Ma'am Jovi earlier. We have, most of our products actually have back-of-pack nutrition declarations already. So this affects both consumer and producer behavior. So for consumer, this affects their preference and the behavior, actual buying behavior. For producers, this incentivizes reformulation. So this is also rights compliant because this ensures that duty bearers, specifically, I mean, mostly the government, we allow consumers to make informed decisions on what to buy. Okay, so this is the logic model for front-of-pack nutrition labels and how it affects consumers and producers. So these policies actually allow for easy access to simplified and easily understandable information. So this improves understanding and use of the labels, which eventually affects makes consumers make healthier purchases. It improves the quality of their diet, decrease in overweight, obesity, and non-communicable diseases. Ultimately decrease in government healthcare costs. Although another very important impact here will be decrease in disability-adjusted life years, increase in the quality of life of everyone. For the producers, this is a more secondary effect, but just as important, it actually changes their knowledge and attitudes, and this will stimulate new product development and product reformulation. So this slide just gives us a global snapshot of the different systems. So we have, we can categorize at the broader level if these systems are nutrient specific or if they employ summary indicators. So under nutrient specific, we can also dichotomize them into non-interpretive and interpretive. When we say interpretive, it actually already has value judgment, you know. It evaluates whether this is good or bad. So for the nutrient-specific non-interpretive, we have the first one is the use of numerical information to quantify nutrients as a proportion of recommended daily intake without making any evaluation. So this one doesn't say whether this is a good or bad product. And these are the illustrative examples we have here from the European Union. We have here from Malaysia. And so we fall under this actually, nutrient-specific non-interpretive. The government endorsing this on a mandatory basis is Thailand, an example, and we are endorsing this on a within a voluntary framework, along with the European Union and Malaysia. So the second major system, is the nutrient-specific, which is interpretive. So this one now has an evaluation. So this this system uses meaningful color, words, and symbols to evaluate nutrient levels across the broad categories for food and drinks. An example of this system is the traffic light. Oh. Sorry, how do I? Paano to? Okay, thank you. So an example of this is, wait lang ha. I actually need the slide before this. Wait, let me. Sorry for here. Wait, parang hindi nag-work tong. Sige. Uh, sige, back muna, back. Yan. Oh, isa pa. Yan. Okay. So, the nutrient-specific interpretive. So, what will fall under this category is traffic light label, such as in Ecuador, and the stop sign warnings, such as the one implemented in Chile. So, governments that endorse this on a mandatory basis include Brazil, Chile, Ecuador, Finland, Iran, Israel, Mexico, Peru, Sri Lanka, and Uruguay. Countries that endorse this on a voluntary, within a voluntary framework is Korea and United Kingdom. The other category is the summary indicators. So now we distinguish between specific to the nutrients, and this one are summary indicators. For summary indicators, these are automatically interpretive because they already have an evaluation of the goodness or badness of the product, quote unquote. So the first one is positive signpost. So this uses symbols, words, and color to evaluate the overall healthier options within the category. So this is encouraging consumers to go with the positive, the healthier options. Examples are the Nordic keyhole. This is in the Scandinavian countries, Denmark, Lithuania, Norway, Sweden. And then choices logo, such as implemented in Czech and Poland. So these are the countries, actually majority of the countries in the Europe actually uses the positive signpost. And then the other one that fall within the summary indicators are the spectrum rating, including positive and negative signposting. So this one actually offers the audience both the spectrum of the negative, positive and the negative ones. And this includes the Nutri-Score, such as what is implemented in Belgium, France, Germany, and Spain, and the Health Star rating that is implemented in Australia and New Zealand. So globally, at least 32 governments worldwide have now endorsed the front-of-pack nutrition label, some system at least. And some governments have more than one system, such as Israel and Belgium. So if you see here, Israel has the nutrient-specific interpretive. They have the warning system, and at the same time, they have the positive signpost. Israel, Belgium, for example, they have the positive signpost, and at the same time, they have spectrum rating. So some labels also operate in more than one country. This one, the Health Star rating, operates in Australia and New Zealand. So there is, click please. So what is clear? The evidence is clear that some FOPL types are not useful for consumers. At least this one we can say. So which is the one that we are using right now? This is not useful for consumers. So there is really an imperative for us to change what we have at the moment. This is the nutrient-specific non-interpretive labels. This is what we have. Next slide, please. So this slide just shows us the labeling schemes and the spectrum of effectiveness. So in terms of regulation type, the voluntary system is less effective, and the mandatory system is the more effective one. In terms of the design, the positive signposting is less effective, and the nutrient-specific non-interpretive is less effective. So this is what we have. The more effective ones are the nutrient-specific and interpretive, which is, for example, this one, the traffic light, and the Nutri-Score. So these are the more effective ones. Okay, so the summary of what works best. So as I have indicated, mandatory implementation is key, and this provides consumers the full benefit of the front-of-pack nutrition labels. This is as opposed to non-mandatory. For example, in Australia, the Health Star rating has only reached 38% coverage after 9 years. And because of course, if you are the producer and there is a chance that if your product is actually unhealthy, you wouldn't be putting this one, right? The color works best, so it enhances the salience and visibility of the label, and it leverages humans' innate tendencies to use color as a diagnostic tool. So visibility is very important. Spectrum labels with summary indicators, the Nutri-Score, best assist consumers to identify both the healthiest and least healthy product options. So at least this one gives them both sides, more transparency. And producers, they are provided with a graded system. So that the Nutri-Score system actually provide a graded system that constitute multiple motivation points for reformulation. This is not working anymore. So there's also a need to select, back please, interpretive label format, and there is a need to select format that includes signpost for product and healthfulness. Next. Okay, additional considerations. It is very important for each country to conduct rigorous research to determine which type of front-of-pack label works best for their people. So this underscores the importance of having an evidence-based policy development. So we need to have whatever decision we have on what type of labeling system has to have rigorous evidence behind it. And an underlying nutrient profile model needs to be developed or selected. This is at least a prerequisite. So FOPL system needs to sit within a broader range of food policies, such as restrictions on marketing to children, school food policies, and even taxes. Accessible, this has to be accessible in multiple languages and or literacy levels depending on the country context. So the use of symbols, this has to be contextualized and be responsive to the needs of the target population. And this has to be communicated clearly to the public and the food manufacturers using guidance documents and public communication campaigns. Next, please. And this is additional consideration. So the effectiveness of the front-of-pack nutrition labels, these are the prerequisites at the level of the consumer. Consumer has to be aware of what FOPL is. Consumers have to recognize the FOPL in the products. They need to understand what it means to use it correctly, right? And they have to have motivation to use the front-of-pack label. So I think that's the last slide. Can you? Okay. Thank you very much.
Maraming salamat po, Dr. Maria Bella Fonferrada ng UNICEF Philippines. Thank you so much, ma'am. And now at present, we have several proposed legislation or filed bills in the Senate and the Congress that are related to FOPL. To tell us more about this, please welcome from the Policy Associate of Imagine Law, Dr. Victor Cesar Ubaldo.
Hi, good morning. I'm Dr. Vico Baldo from Imagine Law, and I'm here to talk to you today about the policy side of FOPL. So, we need to know who are the ones who have already filed the FOPL bill, and what does the FOPL bill actually contain? Okay, so I guess we can start. So again, I'll be discussing about the front of package label bill, and we would like to thank and congratulate the following legislators for being advocates for public health and for having already filed the FOPL bill. So they are the following. Nawala sila. Mabalik sila. Okay, okay. So we have the following legislators who have filed. So first, we have Representative Ino D and Senator Rafi Tulfo, who have already filed their respective bills using the specific scheme, the Health Star rating. Next, we have Representative Brother Eddie Villanueva and Senator Joel Villanueva. This time, the FOPL scheme that they filed is the traffic light scheme. And then next, we also have a few more. The following legislators have already filed the FOPL bill just this year, and they filed specifically the warning label. So these include Representative Reynolds Michael Tan. Next. Representative Samantha Santos, and finally, Representative Rachel Arena. So these three legislators have filed the warning label, and this is actually the specific scheme that I will be discussing next. There. So I will now discuss the salient features of the FOPL bill. So kanina pa natin pinag-usapan yung FOPL bills, but we need to know what does it actually contain? What will it actually look like when it's implemented? So let's discuss it today. Next slide. So first we need to state the objectives of the FOPL bill. So it is the following: to guide the population in making informed food choices, to discourage people from consuming food with fat, sodium, and sugar content in excess of the prescribed maximum thresholds. And then in effect, it actually reduces the prevalence of overweight and obesity, and it is to prevent deaths due to non-communicable disease caused by dietary risk factors. Next. So in this bill, we understand that there are rights safeguarded. These are the right to health and the right of the children to proper care and nutrition. In fact, it's already in our constitution that the state shall protect consumers from trade malpractices and from substandard or hazardous health products. And to achieve this, we have the warning label. So the warning label is a requirement for prepackaged food products that exceed the maximum values of nutrients of concern. And so the form, size, placement, and characteristics are specified in the bill itself. So how will it look like? It will look like the following. Will be one warning label for each nutrient in excess of the prescribed values. So let's look at the octagons. It says high in sugar, high in calories, high in fats, high in saturated fats, and high in sodium. So these are the different nutrients of excess, and these are the possible warning labels that may be present in the packaged food product. Next, there's going to be another warning label for products containing artificial sweeteners, which will contain the recommendation that it is actually not recommended for children, as in the slide. Next. So on the package, of course, the front of package label has to be in the front. Its location is in the top right edge. It must occupy at least 5% of the front of the package. And if there are multiple warnings, they must be adjacent to each other, such as in the picture provided. Next. If, for example, you have a cylindrical product like a can of soda, that must be located in the top center of the product. Of course, still in the front. And if you have small products, for example, products that are less than or equal to 10 centimeters squared, there will be a single octagon showing how many labels it should have. Should it have been 8? And profile model, which was highlighted a while ago as important for policy basis. Next slide. So there are definitely products that are exempted from having a warning label. These are food for special therapeutic dietary uses, culinary ingredients, sugar, you do not label this as high in sugar in it because it is a package of, it is a product of high purity. But let's focus on the prohibitions. There must be no complementary nutritional information, logotized basis of sponsorship or endorsements or scientific societies or civil associations. The package also. So examples of these are, you may already be familiar with them, 40% less fat, less salt, 100% vitamin C. These prohibitions are important because they detract from the actual value of the warning label. Sometimes these nutritional claims are placed there in the product because it provides a sort of health halo effect, which may confuse consumers. So imagine if you have a warning label, but with so many other labels saying that it is a healthy product, it actually detracts from the value of the warning. Bill, and it will also include the following powers, such as inspection of premises and records of food manufacturers, and a mechanism to enforce in traditional markets and food service establishments within their jurisdiction. So, for example, you have a certificate. We know that food manufacturers must apply for a certificate of product registration. If they are applying for a new CPR and they do not comply with the warning label requirement, then the CPR will simply not be issued. And if there are existing products in the market, but they do not apply, but when upon renewal, they do not comply with the warning label requirement, then the CPR will simply not be renewed. Next slide. If there is no warning label when one is required, the result is the package will be the food will be deemed misbranded, and they will have the corresponding penalties which are provided by the bill. So these penalties are similar to the ones provided in the FDA Act, which include imprisonment or fine or both. So these are already provided in the FDA Act actually. So additional penalties include disapproval of the application and suspension, revocation, cancellation of CPR or any authorization, and also seizure and condemnation, destruction, recall, and or appropriate disposition. Next slide. So there is an avenue for consumer complaints. So the FDA may commence an investigation motu proprio or upon letter complaint from any consumer for violations of this act. There will be multi-sectoral coordination and civil society participation, where CSO participation through technical assistance for implementing and monitoring. So please note that these organizations must not be affiliated with the food and beverage industry. Next. So finally, we have a consumer IEC program. So we're not going to leave the population in the dark. We must be able to educate them about the usefulness of the bill. In fact, the bill also provides that the DOH coordinate to conduct child-specific educational campaigns about nutritional labeling. And finally, the last point is a transitory period of 6 months, because it takes approximately 6 months for manufacturers to renew the product labeling. So this is an appropriate amount of time. So these are all the salient features of the front of package warning label bill. That's all. Thank you very much.
Thank you, Dr. Vico Ubaldo from Imagine. Thank you, sir. And in terms of research, what studies or findings do we have on the FOPL for the Philippines? Senior Science Research Specialist of the DOST-FNRI, Mr. Carl Vincent D. Cabanilla.
Thank you, Sir Sander, for that kind introduction. Good morning, everyone. Before anything else, I'd like to express our gratitude to DOH HPB, Director Rodley Carsa and Chino, as well as the Healthy Philippines Alliance for inviting DOST-FNRI to present in this very important event. I'd also like to thank our OIC Director, Attorney Luciden Ras, and our policy head, Dr. Mildred Girandola, for the moral support. So my task for today is to present the results of the formative research, which is one component of the project on the development of new front-of-pack labeling FOPL system in promoting healthy diet in the Philippines. So I'm Carl Vincent Cabanilla, and I'm the project leader of the FOPL project. So we have, okay, next slide. So some declaration of interest. Okay, next slide, please. Okay, this will be the guide. My presentation will be guided by this outline. Next slide, please. Okay, just to introduce, I'm sure most of you are familiar with FNRI, but for those who are not, DOST-FNRI is the lead agency of the government in food and nutrition R&D. These are our mandates, and I'd like to highlight our second mandate, which is to develop and recommend policy options, strategies, programs, and projects which address the malnutrition problem for implementation by appropriate agencies. Next slide. Yeah. So one of the activities that we do in FNRI is actually developing and updating the tools, guidelines, and standards to serve nutritional needs. Okay, next slide. These are just examples of the nutrition tools and standards developed by DOST-FNRI, and one of them is the PDRI, which was mentioned by Ma'am Jovi. The NGF, the Nutritional Guidelines for Filipinos. This is the official food-based dietary guidelines of the country. And our food guides, daily nutritional Guide Pyramid and the Pinggang Pinoy, and also the Philippine food composition tables. Next slide, please. Okay, this was already mentioned by Ma'am Jovi in her earlier presentation about the current situation in terms of nutrition in the country. So we are happy to note that undernutrition, particularly stunting and wasting, are going down, although not as much as we want. But when you look at overnutrition, particularly overweight and obesity, the prevalence is increasing across all population groups and across all socio-economic groups. Next slide, please. So this slide shows a study conducted by the Lancet Commission, which shows that some food groups are associated with non-communicable diseases. Pakiclick po. So those diets high in sodium, high in trans fats, high in sugar sweetened beverages, processed meat, and red meats are implicated with NCD mortality. Next slide, please. Okay, so this is our main project, the FOPL project, which is supported by the World Health Organization country office. So we will be following the WHO guiding principles and framework manual for developing an evidence-based FOPL system. So this is a 5-step approach. We are still on step 1, which is the conduct of contextual analysis. And part of the contextual analysis is the assessment of the nutrition situation in the country, as well as the legal framework. What are the existing policies that are related to FOPL and nutrition labeling in general? And of course, the formative research, which I'm going to present later on. The next step, so after determining the country situation, we can now establish the aim and scope of the FOPL. And this will be followed by a engagement with stakeholders through a consultative process. And then we can now develop the FOPL system in terms of its design and format. And an important input to that is the Philippine Nutrient Profile Model, which is being finalized by the National Nutrition Council. And of course, we can also be guided by the best country evidences on the performance of FOPL, different FOPL systems. And the last part would be the pre-testing. So after developing the would-be FOPL scheme, we will now pre-test it to check if it is effective and understandable in the local setting. And then we will now turn over, after the 5 steps, we will turn over our output to the appropriate agencies for potential policy implementation. Next slide, please. Okay, so I'm going to present the results of the formative research. So the objective of the formative research is to identify stakeholder characteristics and appropriate channels for the development of FOPL scheme in the country. Specifically, this project or this research aims to determine among stakeholders their awareness, perceptions, knowledge, attitudes, and self-efficacy on FOPL. This is the motivation that is being mentioned by Dr. Bella earlier. And to provide ideas for creative packaging of messages and materials for FOPL and client-preferred communication channels for the promotion of FOPL. Next slide, please. So the study team employed a mixed method of qualitative and quantitative methods. They conducted FGDs, or focus group discussion, and online survey. The questionnaires and discussion guides were pre-tested before the conduct of the FGD and online survey. They were able to conduct it in 4 major areas in the Philippines, namely NCR, Luzon, Visayas, and Mindanao. So this is a nationwide study. Next slide, please. So the recruitment of participants were done through Facebook, the official Facebook page of FNRI. So this is a sample call for participants. Next slide, please. Okay, so the 3 groups of stakeholders that were studied by the team were first, the parents or caregivers, Second are the nutritionists, dietitians, and allied health workers. And the third one are food or beverage company staff. Okay, with a total of, sorry, could you please go back? A total of 107 participants for the FGDs and 150 participants for the online survey. Next slide. So this is the profile of the study participants for the online FGD. So karamihan ay mga females, no? As indicated in the pie chart. Yung orange pertain to females, and then mas kokonti yung males for the parents, caregivers, and nutritious dietitians. But for the food and beverage, almost kalahati naman yung males. And then for the age, karamihan ay from the 21 to 30 years old for the parents and caregivers. And for the NDs and food and beverage staff, same age, much older, 31 to 41, but same lang for the food and beverage, 31 to 42 and 21 to 30 years old. And in terms of the place of residence, mas madami yung urban versus the rural participants. Next slide. For the online survey, on the other hand, we have the same profile, almost the same, more female than male participants and more urban than rural participants. And in terms of educational attainment, mas marami yung college graduates than the high school graduates. Okay, next slide, please. Okay, these were the FOPL schemes that were tested by the formative research team, the Sangkap Pinoy Seal, the Nutri-Score, the multiple traffic light, which are nutrient-specific, the Nordic keyhole, and the Chile warning symbol. Next slide, please. So I'm going to present to you in the next slides the highlights of the results. Okay, in terms of awareness, majority of the participants, both parents and caregivers, NDs, and food and beverage manufacturing companies staff are aware of the term FOPL. Next slide. In terms of knowledge, across all types of participants, they answered that nutrient content such as sugar, sodium, carbohydrates, fats, protein, vitamins, and minerals, sorry for the typo error, should be found in the product with FOPL. And across all types of participants, the most known FOPL schemes are multiple traffic light, Sangkap Pinoy Seal, and Nutri-Score. In terms of attitude, next slide, please. Sorry. In terms of perception, rather, could you go back to the previous? Yeah, thank you. So in terms of perception on FOPL, across all types of participants, most respondents preferred multiple traffic light and Sangkap Pinoy Seal. While the dominant answers almost all considered that the FOPL is helpful for their current health condition. And among NDs and parents and caregivers, it is considered that FOPL can aid in understanding the nutritional quality of the product. Next slide. In terms of attitude towards FOPL, across all types of participants, FOPL is considered important in a food product, and all parents and caregivers and nutritious dietitians stated that they will read FOPL. Next slide, please. In terms of self-efficacy or the confidence of the participant to adopt or to read or understand the FOPL, dominant answers are that parents and caregivers are confident that they have the ability to understand the would-be FOPL, and FNB participants think that manufacturers are ready to use the would-be FOPL system in the country. Next slide, please. In terms of marketing and promotion strategies, social media is the most preferred communication channel for marketing and promotion strategies for FOPL. And other information sources include physical stores, online stores, and broadcast media. Next slide, please. So in summary, based on the study findings, there's a a common agreement that FOPL system should be developed. And second, the system should highlight important nutrients, and it should help consumers make informed decisions about food purchases. Okay, as part of our recommendations, next slide, please. In terms of awareness, high level of awareness should be sustained through social media and other online, other information sources. In terms of knowledge, misconception on Pinggang Pinoy, because it is one of the answers of the respondents, especially for the parents and caregivers. They consider Pinggang Pinoy as FOPL. So this misconception should be addressed through nutrition education and other communication campaigns. And in terms of perception, develop FOPL based on multiple traffic light and Sangkap Pinoy Seal. So that's the recommendation of the formative research team. Next. In terms of attitude, we should use design elements such as color-coded, large font, pictures, or icons, which is consistent with the evidence from the global level. Self-efficacy, education on FOPL should be conducted to increase stakeholders' ability to understand FOPL. And in terms of marketing and promotion, we use social media as a primary marketing platform, as well as other sources of information. Next slide. I think that's my, second to the last slides. I'd like to acknowledge the team who conducted the formative research, led by Ms. Shannon Faye Arevalo. And of course, the WHO Philippines for providing support to this project. And with that, thank you for your kind attention.
Thank you po, Sir Carl Vincent Cabanilla. Thank you, sir. Salamat po. We'll be having a 5-minute break po, and then we'll continue the talks.